Myself, WACHEMA from 2nd M.Sc Biochemistry. I can share few points about ethical issues in deep brain stimulation. Deep brain stimulation is currently used to treat the neurological disorders like Parkinson's diseases, dystonia, and it is explored as an experimental treatment for the psychotic disorders like major depression and obstructive compulsive disorder.
Deep brain stimulation raises some important ethical issues, both in the context of treatment and in that of the research. These issues have been discussed in the medical as well as bioethical community, and researchers from both the fields have often collaborated in identifying and discussing the ethical issues. Ethical issues in treatment of neurological disorders. An ethical assessment of deep brain stimulation treatment can depart and is studied by the four basic principles of medical ethics: non-maleficence, beneficence, justice, and reported for autonomy. The first important ethical question is whether the deep brain stimulation is beneficial and does not harm the patient. For disorders like Parkinson's diseases, dystonia, and essential tremor of a deep brain stimulation has been proven to be effective. The risk and complications associated with deep brain stimulation surgery include hemorrhage. Infections included the effects on conjugation, behavior, and including the speech disturbances, memory impairment, aggressions, hypomania, hypersexuality, and depressions. Parkinson's symptoms are Parkinson's gait, rigidity, face masking, tremors, slowed technician's time, frequent fails. Dystonia causes the stroke, brain tumor, infectious drug reactions, Wilson's diseases, tumoric brain injury, or a spine injury. It is highly effective in reducing the motor syndromes of Parkinson's disease, essential tumor, and dystonia for alleviating the chronic pain. The Tourette syndrome, obsessive tumor compulsive disorder, and treatment resistant depression is treated by deep brain stimulation with encouraging the results. In clinical achievements, several animal models of deep brain stimulation have been developed, and bringing a new insights can effects of treatment at molecular and cellular level. It also producing new evidence on its physiological and behavioral consequences. In physiological and imaging studies, the patients have impact on deep brain stimulation to intracellular hemorrhage, infections such as mania, the symptoms associated with.
Conclusions. Deep brain stimulation is effective surgical treatment with sustained long-term benefits. Further, the mechanisms of a deep brain stimulation to improve the efficacy and reduces the adverse effect and identify additional applications for the new autonomic targets in the ethical studies.